Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Stuart Tarnowski, Director of Sales at Advanta Biometrics. Stuart's journey is fascinating, from building extraordinary sales success across diverse industries to becoming a Medicare optimization expert, passionate about bridging the gap between fee-for-service and value-based care. With over 6 years of experience in Medicare services and healthcare business, Stuart has consistently demonstrated excellence, from being named 2015 Salesperson of the Year to achieving multiple President's Club recognitions. At Advanta Biometrics, he is now leading the charge to transform how providers engage with patients beyond office walls, focusing on the crucial 99% of time when patients aren't directly in front of their doctors. Welcome to Health Tech Heroes.
Thank you, Fasa. I'm excited to be here and excited to have this conversation with you.
Yeah, and I'm excited to continue our conversation, Stuart, from our initial introduction. I'm very excited for this.
Yeah, thank you. I'm excited.
Your career seems like you have come from bottom to the top. Here is the idea when I say bottom to the top, from IZ like Yelp and ZocDoc to now AB, Advanta Biometrics. So you have come all the way to the alphabets rising up. Tell me about your journey, and specifically, how did you become a Medicare services expert?
Yeah. I'm a little strange in that I feel that most people fall into sales accidentally, or maybe they study history or psychology or something like that in college, and they take it as a second job, as a career. I started off in a radio business and originally thought I wanted to be on air, and then quickly learned that was not the path for me. So I got into radio business, which was advertised, selling commercials. That's what I studied in college. I was able to get a sales certificate from Ohio University, where they actually had a lot of classes around it, and did my dream internship at UGN Radio, home of the Chicago Cubs, diehard Chicago Cubs fan. So, that was an amazing experience, and I wasn't just getting them coffee. It was extremely hands-on, and I was building out new sponsorship opportunities for them. All at the same time, I had an opportunity from Yelp. And I'm from Chicago, and it included me moving out to Phoenix, Arizona to start my career. And I think for a out of college first job, could not have been a better experience. They had a great training program, and I also was familiar with that platform. With that said, breaking into healthcare is not easy. It was always on my radar. People tend to want a lot of experience from people. So I went out to Yelp in a year out there, learned a lot, and it just so happened that my direct manager and director of Yelp had some relationships at ZocDoc. So I took that opportunity and jumped into it. My career has been split between healthcare and hospitality, about 50-50 overall. But the opportunity to now be working consistently in the healthcare space, specifically the Medicare space, since 2021 has just been really life-changing and eye-opening to what's happening in the healthcare space. Lots of changes are happening. Reduction in reimbursements is a big problem. Clinics being bought out at a rapid rate. I want to say it's about 75% of private independent clinics are now bought out and owned by either payers or hospital systems and equity groups. So there's a lot of change that's happening in the space right now, which creates challenges, but it's also exciting.
That's awesome. This is your origin story. So I want to step back a little bit and understand what happened where you felt like the radio was not your thing. And I think that's an important part.
So I was going to Columbia College Chicago, which was a private art school. I come from pretty humble beginnings. In fact, my sister, 7 years older than me and her are the only two people in our entire family to graduate from college. So even just a bachelor's degree was a huge accomplishment for me and her and the family as a whole. Well, Columbia College is a very, very expensive school. And most kids there came from families that were able to support that sort of thing. Well, once I got into radio and wanting to do on-air talent, it was, hey, you're going to move to Nebraska post-graduation with $100,000+ in debt, making minimum wage. And I was like, okay, how do I make money in this business? I literally went to the professor And I never thought I would be someone that I would do this sort of job. I was always more artsy, creative. I want to be outside. For a while, I wanted to be a gym teacher. So I was shocked once I got into these classes, how much I really took to it and just excelled.
That's wonderful. And I think you did mention a professor, and sometimes those individuals do have such an impact. Short period, sharp, but you have, and I have some people in my life that have had such impact too. So I'm glad you came across that professor and you came across those classes, uh, and you were able to, afford debt. That's a major factor.
Absolutely.
And you mentioned it. You did begin your healthcare journey at ZocDoc, and you were working directly with private practices at that time, I believe, based on your experience profile. How does it influence your perception of a practice based on that experience?
So ZocDoc, right, really has two key areas that they focus on. From the patient standpoint, it allows patients to quickly find providers that are in network with them through their app or through their website, and physicians that have an open schedule, right? If you want to see a doctor today, you can see them. And especially with specialists, that's very challenging, right? If you want to book endocrinologist, you're probably going to book 3 months out. So from the patient standpoint, that's what that did. From the clinic standpoint, there's a really high no-show rate for practices, and ZocDoc allowed them the opportunity to fill those gaps in their schedule. With that said, it is an advertising platform at the end of the day. And whether you're in healthcare or you're in restaurant business, getting new patients or new people to come eat at your restaurant, right? It is about advertising, and it's about more, 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 more. Right. And what we've seen in the healthcare space, what that's led to, especially leading up to COVID and now post COVID, is physician burnout, longer hours. A lot of these physicians do rounds in hospitals. It's become really unsustainable for these clinics to do this. And it's also become a lot more expensive to run a clinic these days, whether it's our AI, Wi-Fi, higher salaries. And what you're seeing is really a crumbling of the old way that healthcare was done, from retroactive, moving towards preventative care, and moving towards more remote services. And out of COVID, what you really got is that patients want remote services, and there's a huge variety of them. The problem is doctors do not have the capacity to do them, right? And that's really the hole, the gap that we're trying to fill here at Advanta Biometrics, and specifically, and I will just say beyond Advanta Biometrics, from CMS's perspective, right? This is the direction of healthcare that they want. They are making it a priority. And when you look at, the old saying, follow the money, um, right? Reimbursements for traditional Medicare Advantage are on a 20-year decline. This year, they went down another 2.83%. But then if you follow the money, it's funny because groups are always talking about or complaining about these cuts, and they're not wrong, right? It is happening, but they're not completely disappearing. They're being reallocated to different areas, particularly to ancillary care, which I always butcher that word. It doesn't come out right every single time. But CMS has made it clear that we want healthcare to focus on preventative care. We want you to focus on remote services. And since 2022, reimbursements are up 50%. All right, so a huge difference. The question is, how do you actually roll these out to where it's not too cumbersome for physicians to execute?
I want to ask that you have had a lot of success in healthcare marketing and sales roles and salespersons. You have been a salesperson of the year. You have received multiple President's Club awards, and you have also relocated to mentor new team members. This is all your profile, and it is almost personal, and there is a mission behind it. There is a drive behind it. What is the drive? What drives you to excel and be on top of it and just be fully present for this role?
I want to start with you kind of spoke about my willingness to move, working in some different industries. Anyone that gets into sales, it's a risk-based job. Why do good salespeople make a lot more money than many other jobs is, well, there's a huge risk. I'm getting paid a much lower salary that if I achieve, I'll make a lot more. But I think when people get into sales, especially kind of like lifelong salespeople, the irony there is they often look for comfort, where I've always put myself in what I would call controlled risk scenarios, right? Which is me believing and myself, the work that I'm willing to put in, looking for structure that an organization has. What sort of coaching do they have? What is the upside on the revenue? That factors into risk I'm willing to take. But that also came with moving. So what you were talking about is at some point I moved from Phoenix to Philadelphia for 90 days to open up a new office. First of all, that was horrible timing because that was March of 2020. So I got stuck in corporate housing for 90 days all by myself. So that wasn't fun. But when you look at my career, even for college, I relocated to Ohio, went back to Chicago, did my internship, moved to Phoenix for a year, knew no one, moved to New York City for ZocDoc. Then they wanted me to open up a new office. I moved back to Phoenix, lived there for like 6 years. Then I went to Philadelphia. Now I'm back in Chicago. And for me, coming back to Chicago is, I've had a lot of loss in my life early on. My father died young, uncles, aunts, grandparents, cousins, friends, literally by the time I was like 15 years old. So my family consists of my older sister and my mom these days. My mom's doing very well. She's 72 years old, but I moved back when she was 68. And that was very important for me to be back, spend time with my family while there's still good years, especially working in healthcare. You really start to see how, unfortunately, depending on the person, deterioration, they could be good at 68 and gone at 72, right? But when I look at healthcare and how that translates to my life, that's why I wanted to be in healthcare. It's because I've seen a lot from a very young age, and I knew I wasn't going to be a doctor, but I knew that I could work in healthcare, can impact um, within my community, then people that I work with. And I've always been selective of organizations that I work with. I'm not just going to work with anyone, right? They got to have good values, a good mission, a good team. I want to be able to collaborate, enjoy coming to work every day. So these are all things that I look for that has enabled me to take risks and also be very successful in my career.
That's awesome. That brings us to Advanta, an organization that has a good purpose and mission and has a good structure, and everything seems like Advanta Biometrics has been a good place for you. So talking about Advanta Biometrics, it focuses on critical insight that nearly 100% of clinical decisions are based on less than 1% of patients. Can you explain that concept a little bit deeper, and essentially what does Advanta Biometrics do and what is it does really well that others don't?
Yeah, so I want to, I spoke about it a little bit before, but what is happening in healthcare, especially in a post-COVID world, right? I mentioned how patients want these remote services. They also want to reduce their healthcare spend. That's really important to them as well. And you see that, kind of being worked out in the environment that we're in here in 2025 publicly. But as I mentioned, physicians don't have the capacity. And on top of that, they're being bought out in an alarming rate. And again, I know I mentioned this, but I believe it was 2018, if I recall correctly, that 36% of private or independent clinics have been bought out in some capacity. And that is simply alarming. So we want to be able to support independent clinics by increasing quality of care, increasing patients' access to care in between visit through remote services. And really what we're doing is acting as an extension of care for the clinic and then also acting as a patient advocate for the patient. So we have a clinical team in-house that work from home. They are remote. We have medical assistants, LVNs, nurses, general providers. We have a pharmacist for consult, a dietitian. Then we also have a quality oversight team, and that's between our COO and then our VP of nursing combined. They have about 22, 23 years of experience. So they oversee the team, and we have a hierarchical system depending on different protocols or escalations. Ultimately, what's happening in layman's terms is we are a communication channel between the patients and the clinics. on an ongoing, everyday basis. There's also two-way communication. Patients can call or text their dedicated care manager at any time. We also schedule and reach out to them 1 to 2 times a month, just depending on the patient. And then we also have 24/7 access for the patients as well. So if something does come up overnight or something acute or they really get sick or, it could be a variety of reasons, right? My grandma, I know she really struggled to sleep at night. She'd always watch her Westerns at night and she's up till 4 a.m., right? So you got to have these various hours. But we build a personalized care plan for the patient, help them achieve their goals, and also coordinate care with the clinic and then also with the referral partners, okay? So what does this look like? What's actually happening? Everything from symptom management, disease education, and symptom awareness, coordinating care with the front desk, including follow-up appointments and referrals out, medication management, adherence, refills, diet and nutrition. Mental health is a big one. And I think it's an understated one. So we do a lot of things around that. Social determinants of health. I mean, that could be as simple as, does a patient have access to a vehicle to make their appointment? Or is telehealth better for them? Right? Or in the summertime, there's a heat wave, right? Did their air conditioner go out? Or does it typically go out? Right? Do they have access to a food bank? Little things like that. And social support. That goes along with mental health, but I cannot understate, right? When you think of the elderly population, how lonely many of them are, or at some point will be, right? Their spouse died, their kids don't check on them that much, right? Maybe they put them in a home. My stepfather right now, he talks about all the time, he's going through dementia, and he's like, I have like one friend left. He just turned 78 years old the other day, and he just talks about how all his friends have died, right? And so that really just kind of eats at them, and we provide that social support. All of that is billable under CMS, right? Or chronic care management. All non-face-to-face clinical care for a patient is reimbursable.
So my next question was, who cuts your check? Essentially, who's your client? And I think you answered that. And how do you find these clients? Like, who are you reaching out to? Like, do you reach out to the clinics and they refer you to the patients, or do you reach out directly to the patients, or do you reach out
Yeah, that's
to?
a good question.
Yeah.
That's a good question. So we work with clinics. We service patients, but in order for a program like this to work, you have to do it on behalf of the clinic. So the clinics are our clients, and then we get access to their eligible patients. We enroll them in the program, the patients. So for instance, chronic care management would be 2 or more chronic conditions, which is 80% of the population, seen in the past 12 months. It's just little things like that. And then Medicare Advantage is the core. There are some commercial payers that are reimbursing as well, but that varies city and state and what those copays look like. But at its core, Medicare and Medicare Advantage reimburses for this program. There's usually not a cost to the patient for this whatsoever. These services are covered by Medicare. And from an education standpoint, I think if more patients knew that, they would be requesting this from their clinics if they're not providing these services. But even this morning, I had a nephrologist contact me and said, this is something I've been looking into, but from my understanding, this is not for Medicare Advantage. I mean, he's completely wrong, right? It absolutely is. So we partner up with the clinics, provide the services for them, but we also communicate with them. That is something that is very different. So we reduce administrative work and escalations by about 50%. But there are still some things that we need to route back to a clinic, change in medication, maybe an appointment, or we identified a new symptom, right? So when we route that back to the clinic, we do that through an internal chat system, like an EHR chat, Slack, something like that. And then we also document directly into the patient chart in the EHR. So when that doctor does see that patient again, which is usually only 3 to 4 times a year, they know what's been going on with their patient throughout the year. And that's really the biggest disconnect, is that physicians have no idea what's happening to their patients when they're not in the clinic, which if you did it by hours, 2 to 4 hours out of the year. Well, there's a lot more
Yeah.
happening day to day, right?
And when the patients change the doctor, does this data transfer to the other doctor even if they're not part of the program? How does that work?
That's a good question. It 100% depends on if that other doctor is doing it. But I guess think about this a little bit. A patient can only be enrolled in one program at a time. So this program is open to pretty much every type of specialty. And just to give you an idea of some, because sometimes there's confusion, people tend to think this is primary care, internal medicine, family medicine. While that's true, it's not specific to them. We do tons of work with neurology, nephrology, cardiology, endos. You got gastros, urology. I mean, the list goes on, rheumatology. So if a patient is enrolled with, say, their family medicine doctor, and then they also work with a nephrologist, and that is always also doing the program. At the end of the day, it's first come, first serve. So there is competition for these clinics to capture and move over to these programs. Now that might change in the future. CMS does change the rules year to year, but right now they can only be enrolled in one program.
The next question comes from, we are a health tech heroes, right? The health tech part. You
Yeah.
are doing something with the AI care plan builder called the MyPlan. Any insights into that?
Yeah. So that would be our newest product. We've rolled it out about a year ago after doing a pilot. Let me give a little context of why this was even rolled out in the first place. I'm not going to say the name of this other organization, but I will say it's a billion-dollar company and they do a ton of work in the neurology space. One of our largest neurology groups that we have a really strong relationship with in Los Angeles actually invited our C-suite in and wanted to show us what their process was to do a cognitive assessment care plan just for one patient. And it was extremely manual. They said on average it took them anywhere from 90 minutes to 2 hours to do one care plan. They have thousands and thousands of patients that are eligible for this. And the CPT code, the reimbursement for this, is extremely high. So on average, it's $270 per patient every 6 months to do a cognitive assessment, not only for the patient, but for their caretaker, their son, their wife, nurse. Right? Now, when we built out our solution, we were able to get it down to 10 to 20 minutes. So we have built and wrote our own artificial intelligence, and we have a question set that then you put in the inputs and sometimes prompt further questions. Once you go through that, which includes things like GAD-7, PHQ-9, ADLs, medication, a couple other things in there as well, but it goes through these different categories. Then our AI takes those answers and turns it into a readable care plan that comes out to be about 12 pages long, addressing all these areas. That's going to help their caretaker and the patient how to navigate cognitive decline or depression or Alzheimer's, Parkinson's, etc. It's really exciting.
And how has been the reception to it?
Yeah, what's interesting is it's not just for neurology. So kind of big picture here. They were talking about it last year, but in 2025, it was basically being made clear that identifying cognitive decline earlier was being put back on primary care. They wanted them to start doing assessments so that they could then refer them out to specialists and help them, extend their quality of life. So what we've seen in terms of adoption is neurology, primary care, psychiatry, and trying to think if we got any other specialties currently using it. I believe that's it right now, but the adoption has been absolutely fantastic and the feedback has been pretty amazing as well. I mean, I have a psychiatry group that did their first 15 MyPlans with us. They did that within about 2.5 hours. Those 15 care plans for them generated them about $4,500 in net revenue in 2 hours. That's really difficult to say in the healthcare space.
It's fascinating. Essentially, you said it used to take 2.5 hours for one patient. Now you're talking about 15 patients, a scale up of 1,500 percent. Yeah, efficiency. So being at Advanta Biometrics seems like it's a very rewarding experience for you. Is there any case that comes to your mind where you said like, hey, I'm really proud to be here. This is like such a great win for Advanta. Is there an example that you have that you want to share with us?
Yeah, I wouldn't say there's a specific, I could talk about a couple specific groups, of course, but I think it's more about what we are doing with studies and outcomes, right? Tracking interventions. Immediately what happens with us is that you'll get patient feedback very quickly. You will also get revenue back very quickly. So this happens over the course of a month. So June just has not started, starts tomorrow, I believe, right? So it would go throughout the course of the month. And then the reimbursements come back from it the next month. Within about 2 weeks to 3 weeks, you will get the reimbursements. So you will see revenue from it very quickly. You will see positive patient feedback from it very quickly. But being able to work with groups that are very bought in to this shift in healthcare and what it means not only for the clinic, but what does it mean for the patients? And those clinics that want to do different sorts of clinical studies with us, tracking outcomes, different sorts of patient surveys. We've done even ones from a satisfaction survey on a pretty large group of ours where they had way more patients per provider than they should have, to where it was becoming a big problem. And it was being seen in patient loyalty. They were also had a huge issue with no-shows because they also weren't answering the phones enough from a front desk perspective. And then people were also going online and saying things as well. So they wanted to do a survey of what did we do in the first year to improve all of this, right? So we're starting to do a lot more studies, including clinical outcomes. I think that's what's really exciting, beyond just talking about success, about revenue and like reducing administrative burden, right? What's really important here, right? And how are we reducing the cost of care and being able to prove that we're making a difference in that area? That's what's really exciting.
Yeah, definitely. You can improve what you measure. And if you are going to measure patient outcomes, I think the goal becomes very clear. That's where we will end up focusing on improving patient outcomes. And that's why we are here.
Yeah, absolutely.
And challenges with Advanta, sure, you have growth pains and some challenges for sure. What kind of challenges?
Definitely, it's really the bigger overall shift. And there's actually a story that comes to mind, right, when thinking about change, right? Change is difficult. No one likes change. People tell you they like change, they're lying to you. That's because maybe they've had 6 months to know it's coming, right? Earlier I was speaking about some professors throughout my years in college that have definitely made an impact on me. And when I was in the business school at Ohio University, I took a class I don't remember the exact title, but it was about change in a business setting. Okay. And it was the first time this class was ever ran. So you couldn't ask other students like what was going on with this class. And I remember the first day he asked, you got to remember, we're all 20 to 23 years old. Right? And he asked everyone to put up their hand if they think that they handle change well. Okay, so everyone puts up their hand. Then he asks, how do you think your parents handle change comparatively to you being young adults? Oh yeah, of course, our parents, they can't handle change. We can adapt, right? So then he tells us what the course agenda is going to be, right? And what he started to do was change it throughout the quarter without telling you. He would tell you to go home and read 50 pages in a book, and we're going to have an exam on it when you come into class the next day. He would get into class and go, you know what, I changed my mind. We're not going to do this exam. And people would get mad because they're like, I spent 2 days reading this. What are you talking about? Right? He was changing everything without telling you. Turns out all you had to do to get an A in that class was make it the whole quarter. If we started with 50 students, there were about 20 of us left afterwards, calling their parents, going to the dean, complaining, right? And that's what I think about, like what's happening in healthcare right now. People don't want to change, but the reality is the shift has already occurred from CMS. You're already behind the ball if you have not adapted. And again, you can see this from the decline in reimbursements from Medicare. You can see it in the increase from CMS for things like chronic care management, remote therapeutic monitoring, behavioral health, advanced primary care management just rolled out this year. It is here. And having to educate that to groups and really paint the picture of what's going to happen to you if you do not get on this bus or get on this train, that is the biggest challenge. It's the education piece.
What a beautiful story. And you brought the message home really, really well. I appreciate that. And just to give credit to that professor, I would love to hear his name. Do you remember the professor's name?
I was trying to think of it when I was talking about it. But a doctor, somewhat a B. I have it, I remember drawing on I wrote his name on his chalkboard. Like I said, I was always creative, very artsy, and it actually looked really good. So I have a photo of it online somewhere. So I'll have to grab that. But I ended up taking like 4 classes from him. He would let me meet with him one-on-one on the side. He was one of the first people for me in college where, early on, like many, I was still figuring it out. Didn't necessarily realize how smart I was or stepping out of my comfort zone. And he really just helped build me up as a young adult. So I should know his name, is what I'm saying.
Hey, I think in your mind he's bigger than any name or anything. He's just a personality. It's like a figurehead. Name doesn't matter at this point.
What sticks in my mind about him is he was kind of the rebel in the business school. So all the teachers had to wear suits. So he would wear a suit, but he would not wear dress shoes. He would wear skater shoes, like Vans shoes all the time. And he actually was a cyclist. He competed against, oh man, what's his name? Armstrong. Like he would do like the Tour de France and stuff like that. He was a very quirky guy himself and stood out. So definitely very memorable.
Man, he went. He was competing at the top level, and perhaps he's the
Yeah.
one who changed the trend and brought the Vans into everyone's feet, man. So there is some blame he should he should face too on that part.
Good guy.
That's impressive that we are talking about him and many years later and with so much respect and love. It's those things, just one class changed your life. Coming down to Medicare service and value-based care, which is evolving, changing so dramatically from your perspective. A couple of questions. As a thought leader, I think very few people understand this space as well as you do. What is it going to look like in like 4 to 5 years? What is that like critical few things that you really want people to know that, hey, this change is going to impact you dramatically?
Well, there's a couple shifts that are already happening. It's just a matter of the timeline of where this just becomes standard, right? But right now, everything's moving towards value-based care. You've brought it up a couple times, right? When you look at chronic care management, it is really a bridge between fee-for-service and value-based care, right? Everything that happens within chronic care management, it is quality driven. Right now, on the value-based care side, everything is quality driven, but your money is tied to that as well. So you need to achieve uh, certain percentages. Whereas on the fee for service, you do a service, you get paid. So that's where CCM is the bridge because it is quality focused, but pays in a fee for service model. With that said, when you kind of follow CMS and the things that they roll out and how they take baby steps, I could see 5, 10 years down the line where everything's value-based care. And they've just been shifting people there. The other things that are happening in the space would be you're seeing a huge increase in mental health services. And again, especially post-COVID and people looking at what isolation did to themselves and to others from just how people live a much more isolation lifestyle these days, even though we have a global world. There's a much bigger focus on that. And then population health management would be the third really as it relates to communities socioeconomically and then also clinically. And from Advanta Biometrics standpoint, that is where we are going as a company. We are not just going to be a CMS ancillary services organization. We're not just doing chronic care management and remote therapeutic monitoring. It is moving towards population health management and really being focused on advancing the standard of care that is affordable, accessible, and valuable.
That's awesome. One particular question, going back to one of the answers, one of the things that you had spoke about Advanta Biometrics, you have made the system very efficient. Just with the example with the MyPlan, instead of sending out one reimbursement, you can send out 15 reimbursement at the same time. I think on the other end, who are reimbursing are going to notice the change. Do you think that is going to have an impact on their reassessment of how much they are going to reimburse, how they are going to reimburse? Because of that, what would be the advice of people in the healthcare area? Should they be adapting the technology as soon as possible? Do you think not only that, if they don't do this, it'll be a reduced income opportunity as we go forward? What do you think about that aspect?
Yeah, there's layers to that question. I mean, yes, reimbursements are going to change. At the most core level, there's no question about it. And they do change every year. There's a new fee schedule that comes out every year. When you look at, so CCM, chronic care management, was rolled out in 2015. The reimbursement starting, I believe, was $42 for the first 20-minute code. It's a time-based event. That's the only code they even had at that time. Then they rolled out a 40 and a 60-minute code, or, 439. Wow, I know that one off the top of my head. I lost that for a second. But then they rolled out 40, 60-minute code, which was an add-on code, right? Now, if you look at those two codes from 2015 to now, 9490, that 20-minute code, the average reimbursement is 62. So up from about 45 to 62. And that secondary code, which didn't even exist for the 40 and 60 minutes, is about $45 every time you hit it. Do I see them decreasing 10 years down the line a little bit? Yeah, of course, right? When the adoption gets there, they're going to make adjustments, but it's going to be much higher than your retroactive traditional Medicare reimbursements, your E&M visits, right? I mean, an E&M visit right now, depending on where you're at in the state, but I've seen them, $35, $40. So that's always going to fluctuate. But what I think is interesting that goes along with this conversation is when you look at the amount of doctors that are choosing to either be bought out by a hospital system, so now they're employed by the hospital, or young physicians, right, out of residency that are choosing to go work for hospital systems as opposed to working for independent care. This is a hotter topic than I think a lot of people realize outside of the healthcare space, because these independent physician owners are saying, these young doctors don't want to work as much, right? They want what I have that took me 20 years to get. They don't want to work on weekends. They want higher pay, and they want more flexibility. Right? They want better benefits. Well, where can they get that? They can get that at the hospital. That's easy for them to do because they have so many employees. Now, what's going to happen though when 90% of all physicians are employed by hospitals? That pay is going to go down. They got the market now. Now they don't have to compete with the independent clinics whatsoever. So all these benefits that you thought you had, those are going to go away as well, right? So it's kind of a catch-22 when you really think about it, big picture and medium and long term.
So you have transitioned from healthcare to non-healthcare and back to healthcare. What is the difference in mindset for people who are aspiring to change into healthcare and come into healthcare from a sales perspective? What is that? What is your advice for people who are
Yeah.
trying to look into it?
So let me just say in sales in general, since 2020 is probably the easiest time frame that I would put my finger on. There's been a big shift in general, and the reason for that is AI, automation in general. Sales organizations that have big venture capital and they go out and hire 100, 200 sales reps, and they just inundate business owners with phone calls and emails constantly. You used to be able to do the approach spray and pray, right? You send out enough, you make enough phone calls, people are going to get back to you. That approach is pretty much sailed. It is more about personalized approach now, strategic thinking, being creative, how to stand out, how to be an expert in what you're talking about, how to provide information to other people, not only the people you sell to, but your sphere, your space. So within healthcare, right? How can like on LinkedIn, right? You came across me on LinkedIn and wanted to chat initially, and it's probably because of the webinars that I do. It's probably because of how I engage with my peers. It's probably because of opinions that I have on the healthcare industry. That is the overall shift, whether you're in healthcare or not. Now, specifically in the healthcare field, what I will say is physicians, they go to school together. They've known each other for a long time. Lots of times their families and their friends are in the healthcare space. Then they become physicians, and now they have referral partners. I'm a primary care. I got a dermatologist. I got an endo. I got a cardiologist, right? This is literally how their networks are built. And trust, community, networking, building quality relationships is the big difference of working in healthcare versus working in any other field. I would also add building channel partners. And for those that don't know what that means, would creating relationships with people that are in a similar field as you, but aren't direct competition. So in my field, I have relationships with quite a few RCM medical billers. In fact, I hosted a webinar on Wednesday of this week called The Fight to Keep Independent Care Alive with the CEO of an RCM company. And that was for a healthcare networking organization called the MGMA. So, it's really about relationships and not so much about it's more about quality as opposed to just blindly reaching out.
Any advice for the leaders who are getting into this space? A quick advice.
Yeah. I just mentioned automation, AI, right? There's more tech than you can imagine in the healthcare space, and that's here to stay. And there's some really incredible work that's going to come out of that. But often this technology actually makes the patients feel disconnected. It creates, especially not only the patients feel disconnected, and the process is it's another app, it's another login, it's another something that the patient has to do. That actually becomes a blocker for the patient. But then when you look at the relationship between the physician and the patient, technology has a habit of not making it very personal, and that is a problem. So I would really tell people to look at ways to support independent clinics, and that patient and provider relationship is key. I would love to see more technology and growth in that space. And the other thing about technology that you have to be careful about within particularly groups that have a lot of Medicare patients is these services that we're talking about from CMS. One of the requirements is there has to be a human level, right? It cannot be done by AI. It cannot be done strictly by technology. Of course, there's a software component to it, but some of these AI models and these tech models could actually eliminate massive streams of revenue that could otherwise be captured. I think I'm always excited to see technology that comes out in this space that keeps that in mind and is trying to not only keep independent clinics in business, but actually grow that population.
Wonderful. So essentially use technology to build relationships and use technology not to cut corners, but to find solutions and more efficient solutions to build this community and make sure that you are utilizing the technology to build your revenue and reach out to more people. As a final
So I was going to say, efficiency is one thing, but efficiency that eliminates revenue opportunities, not so good.
very important. I think revenue does drive innovation in a way. Final 90 seconds for you, Stuart. You can build your own question. So whether if we have missed some discussion that you think is important, or if you want to reiterate something that you think is important, it's up to you. It's your question, your answer.
Yeah, absolutely. So as I mentioned, half my career has been spent between healthcare and hospitality. The past 4 years during COVID and to now in healthcare. And then previously I was in healthcare several years ago. But what's happening now in healthcare, you can look to hospitality for a direct correlation of what happened to them. So when you think about COVID and you think about restaurants, the first thing that comes to mind on everyone's mind is how many restaurants shut down? How many of your favorite restaurants shut down? How many of your favorite bars shut down? You could probably drive around to your neighborhood now and not even recognize half, if not more, of the hospitality, restaurants and bars, because they all shut down and now there's new ones in its place. And do you like those new ones, right? Do you have the same relationships with those new ones? Do you have the same memories? No. And what happened was, yes, COVID happened, but the bigger thing that happened is a lot of restaurants got stuck in their ways. They did not want to change. They did not want to adopt new technology. They did not want to incorporate delivery services into their business. They did not want to do customer loyalty. And when a big event like COVID happened, the restaurants that tried to adopt when it was too late, like everyone else, they died. Some of them died within weeks, if not months. They couldn't capitalize on revenue. The loyalty that they thought that they had with people that came to the restaurant wasn't as strong as they thought it was. That is the exact same thing that's happening in healthcare. The groups that do not build strong, quality relationships with their patients, they're going out of business. They're getting bought out for pennies on the dollar. They worked their whole lives to work for themselves. Now they're employed by hospital systems and they lose control. And the bigger picture on this is bad for everyone involved. It increases costs for the patients. It reduces access for the patients. Physicians lose control, and it's really bad for the system of healthcare. Everyone's insurances will go up, and when all the services are having to go through hospital systems and private equity groups, you lose that personal touch. So it's just a little bit of a reminder of we've seen this before, but it is happening in healthcare right now. Maybe not as fast as it did because of COVID within restaurants, but it is happening right now. That's my overall message that I really want to seek in for people. I appreciate you having me on today, and I enjoyed my time. And again, thank you.
And thank you very much, Stuart. It's been it is basically a semester of course that I went through with you on Medicare and the challenges and the technology, and I truly admire your passion for what you're doing as well. So thank you very much for being here today.
Yeah, thank you.